Do you treat younger patients any differently than older patients? So when I say younger,
Yeah.
I'm talking anywhere between 35 and under versus anything older.
Well, what comes to mind for you first? Why do you think you should or shouldn't? Like, what's your perspective?
Yeah, so I would say initially, to be honest, I try to say no, I treat them all the same, but maybe it's a bias kind of thing. I tend to treat them a bit differently. I would say now I'm getting better at treating them for their condition and their specific symptoms rather than their age. So when I say that, I mean whether you're 65 or 35, if you have the same level of pain, same kind of injury, try to treat it the same and go from there. So does that kind of help out a little bit?
Yeah. Yeah. So how I think about this now versus as a new grad. When I was a new grad, I would have treated them differently, just because it's like, oh, Miss Grandma, you can't do anything. Let me help you to the table. Of course, there is a level of safety to it, but now I'm just like, well, go to the table. You can do it yourself. So I'm much more independent with, especially when you get into your elderly geriatric population. But to answer your friend's question, is at the base physiological level, I treat everyone the same because most of the time, for what they're here for, the problem is inhibition of the muscle fibers in the neuromuscular junction. Outside of, well, even post op is the same thing, but outside of like fibrosis and really locked up scar tissue or something that's actually at the joint mechanically with the tissue or the joint, or it's just arthritic and it's just almost bound together, then that's a different story. But almost everything else is inhibition or reciprocal inhibition at the neuromuscular junction. So whether it's a 86-year-old grandmother, a 42-year-old weekend warrior, or a 16-year-old basketball player, especially as it gets younger, the main problem stays the same as neuromuscular inhibition. So I'm treating neuromuscular inhibition, whether it's the shoulder, the hip, the knee, the ankle. Then after that, reinforcing what we established at the facilitation level, if that makes sense.
Yeah. I think going off of that, let me first ask why did you, when you were a new grad, like you said, why did you initially kind of treat them differently?
Because I was scared. You know, they scare us in school. They're like, oh, don't let anyone fall. You're going to lose your license. Everyone has to be super safe. You don't want to break anything. You don't want to mess up a surgery. Like, they scare us, and I understand, at least